www.charlotte.org. When's the last time you had to go to the hospital? No one wants to go, and I may be one of the biggest. But when you're sick, we expect high quality and really want low prices. One Charlotte-based company works with healthcare systems across the country to reduce healthcare costs and improve patient outcomes. Carolina Impact's Danielle Koser shows us how Premier Incorporated uses technology and the power of group purchasing to make a positive impact on healthcare.
From pills to syringes, each day hospitals use thousands of pharmaceuticals and supplies to care for patients. Premier Incorporated works to lower the cost of these items through supply chain management, negotiating lower prices on high-quality products for 3,600 healthcare systems across the nation. The company manages 2,000 contracts for more than 1,000 suppliers, using its high-volume purchasing power to secure discounted prices for the products and services providers use daily, helping them save an average of 10 to 18%.
So to give you an example of the scale of that, we have approximately 2,000 categories in our portfolio, and we have diverse supplier options for our hospitals to choose to do business in across about 300 product categories.
They really need the scale of a Premier who can take $44 billion of purchasing volume, go to the market, and really get prices that they have a very difficult time getting on their own.
Durrell Gilbert, president of Supply Chain Services, says Premier's presence in Charlotte began in 1969 when its predecessor, SunHealth, opened. The current Premier Alliance was created in 1996 as the result of a merger. About half of Premier's 1,800 employees work out of its Charlotte headquarters in Ballantyne Corporate Park, where data is king.
Data is critical because how do you change if you don't have the ability to look at the outcomes?
Is that right?
Huddled around computer screens, analysts plug data into pie charts and bar graphs. Premier uses these numbers to help hospitals save money on medical supplies while improving the quality of care for better patient outcomes. Caramount Regional Medical Center is one of nearly 100 hospitals Premier serves in North Carolina. The numbers give Executive Vice President and Chief Medical and Safety Officer Todd Davis a glimpse of the hospital's workflow, allowing him to identify areas for improvement.
We identified a trip hazard in the doctor dictating area.
On floor 3 South, nurses gather around a whiteboard for their morning huddle, pinpointing problem areas and safety hazards.
Good morning.
Premier also helps hospitals make sense of data through consulting services. Caramount Health is a member of what the company calls the Quest Collaborative. Launched in 2008, the program includes about 350 hospitals comparing data transparently, sharing performance and expertise.
So suddenly, Caramount didn't have to newly discover every single thing that we were doing. We're able to talk to other organizations to find out what they have done before to help solve that problem, or what they have tried that wasn't successful.
Davis says the data available through Quest helps the hospital lower its instances of sepsis, a potentially life-threatening complication of an infection. Since 2002, Caramount Health has dropped the mortality rate associated with sepsis by 40%.
That is hundreds of patients a year that are spared because of that. A significant amount of the changes that occurred were led by the staff based upon information and processes that we were able to gain that other organizations have done as well.
Premier works to improve the quality and safety of patient care by turning data into something tangible, like more affordable pharmaceuticals and supplies. With thousands of members across the nation, Premier works to transform healthcare for millions of Americans. For Carolina Impact, I'm Danielle Koser reporting.
Thanks so much, Danielle. So how